guys are in right now is the holding area. Like I said a few seconds ago, like I don't care if you eat, I don't care if you do whatever. Like you guys can smoke. If you smoke a cigarette, you just have to take it out to the road right here and take your cigarette butts with you. Alright? So to your right, my left, that's where the retest area is. You have to get a no-go one day. It's going to actually have the same equipment that you see here, minus the glitter stand. Alright? Just keep in mind the glitter stands don't have these with them. This is separate entities. I had a question about that. And then the test area is actually right behind us. Alright, the test waiting line is right there. Alright, so if you want to follow along in your EIB books, so when I go over the condition parts, I'm going to point out keywords. So if you want to underline that keyword, or circle it, or highlight it, however you want to remember that keyword, because those keywords are going to transfer over to the TCC card. Alright, it's going to help you in the long run. Alright? So here we go. Let's go over it. So this is evaluate and treat the casualty for a spinal injury and shock. Alright, task. Identify signs and symptoms of shock. Evaluate and treat casualty for spinal injury and shock. Conditions. You are a member of a platoon within a secure forward operating base, which is a FOB, in a non-CBRN environment. You are assisting another soldier with an injury to a fellow service member and preparing him or her for evacuation while waiting for medical evacuation, which is a medevac. Alright, the other soldier states that he or she witnessed the casualty fall from the guard tower. So fall is a key word. Alright, so fall will be one of the key words. You want to underline that, highlight it, whatever. He or she suspects internal bleeding and a spinal injury. So internal bleeding and a spinal injury are key words also. He or she goes on to state that after initially acting fine, the injured soldier began complaining about nausea, difficult breathing, and abdominal pain. So those three words are key words too. The injured soldier is lying on a litter with a long spine board when you arrive and is alert to pain only. So pain only is a key word. Alright, the uninjured soldier is available to assist you with spinal stabilization and movement of the casualty while you provide treatment. Alright, like that said there, your assistant, he's going to be there for spinal stabilization. So all he's going to do is just support the head. Like so. That's it. He's not going to help you with the straps or anything else that's on his lane. His job is just to stabilize that head. And he's not going to help you with the blanket. Alright? Standards. Identify at least 6 signs and symptoms of shock with no incorrect answers within 1 minute. Alright, so here's the signs and symptoms. There's 12 of them. Alright. I would remember the 6 easy ones. Alright, I would not try to remember number 12 because that's super long, right? I would not remember that one. So you can go with the first 6. I don't care how you do it. But just number 6 of them, alright? We're going to provide you with a piece of paper that's already laminated and a mat marker. So you're going to write those 6 answers down. Okay. So once you write those 6 answers down, when you go to turn them in, just let the grader know you're done. Say, grader, I'm done. Alright, so we don't get into a staring contest and stare at each other. Alright? Say, grader, I'm done. And stop your time. Alright? Next, you're going to apply a cervical collar, treat for shock, and prepare for transfer to standard in sequence within 7 minutes without causing further injury. Alright, 7 minutes, that's a long time. Alright, believe it or not. If you actually read through this, you go through the steps with like a battle buddy, like 3 people, you can actually train yourself at the cough. You just have someone just lay down, you know what I mean? And someone just talk through the book step by step. You can actually get it down probably 3 or 4 reps. Sergeant Bryce got it down to like 5 minutes and 40 seconds. Alright? He was literally just talking himself through, going through everything. Because most of the time you're just basically coming from the neck down and back up again, twice. So just remember all the steps. I know it seems like a lot of stuff, but when you actually do it, it goes pretty quick. Alright? That's the thing. Like you may seem like this is long, but when you actually go through it and say it, you'll see it here when Sergeant Bryce goes through the demo, it goes pretty quick, right? When someone's with you and is helping you. And then once you get to the bottom part here, where it says measure in 30 seconds, you can write some of the keywords down, like, because the grader will say, hey, 30 seconds has elapsed. 150 beats per minute. All right, you can write that to the side, so when you do practice, you already know what the grader's going to say, right? but the only difference is the beats and breaths are going to be different. That's the only thing during test day. All right. So it's on Bryce. He's going to go over all the performance steps, what test day is going to look like. So I would pay attention to him. He's pretty good at it. You want to take some notes while you're going down through it. Your EIB books, go ahead and write in there as he's going down through it. Just pay attention, all right?
All right. So first off, just so everybody knows, the Casualty will not be on the stands. It'll look like this setup over here, and then you'll actually have a board underneath as well. Okay. And then also with the cervical collar, we understand that the way this actually is put on is with this bent over, so the Casualty's chin can comfortably sit. All right. But to maintain the integrity of the cervical collars, because we have a limited supply, we're going to keep this downward and work with it like so. Okay. When you first go up to the testing station, you will identify the 6 signs and symptoms of shock on that notebook piece of paper. It'll tell your grader that you're done. After you are done and you have proceeded to go, you'll move on to the next steps in the performance measures. All right. So after you've been read the task condition and standards, your grader will state that you can take off your gloves and you can place your weapons off to the side, because you're operating in a secure forward operating base, just like it was stated in the conditions. All right. The reason that you have your gloves off is so that you can receive skin-to-skin contact whenever you're getting your pulse rates throughout your performance measures. Then your grader will state to inventory your gear and ensure that serviceability. All right. Things that you want to note: you want to ensure that your buckles don't have any dirt on the inside, which will mess with the fact that you trying to actually slide it inside. All that grain, it would make it harder for you to get it all the way through. All right. Then you'll lose time. Another thing you want to note is your immobilization block. You can lift your heads up real quick, Linzo. You're going to make sure you have this latch still here. Just be real gentle with it. It doesn't take much to lift that up. All right. Same thing with the cervical collar. Ensure that all your notches work. Your slides work as well. Okay. So just to list off everything on the inventory list that you'll have the 2 straps, you'll have a litter, the spine board which your Casualty is laying on, your immobilization block which your Casualty's head is resting on, a cervical collar, a blown up TC3 card, easier to write on. You have your note card as well to take your notes for your respiratory rates and your pulse rates. You'll have a BLS bag, the cervical collar, as well as a pen to write with. And at this time I cannot find, but if that were the case, what you do, you tell your grader that you do not have the pen, the grader will supply you with it, and you'll be able to perform your performance steps. Okay. You will also have a space blanket. Okay. Now we're actually going to move into the performance steps. So at this time, after you are done inventorying your gear and ensuring the serviceability of it, you'll let your grader know that you are complete. All right. Your grader will show you all zeros. At that time, the grader will state time will begin whenever you begin. The first step that you are going to take is to tell your assistant to maintain head and neck inline stabilization of the Casualty. You will then reassure your Casualty everything is going to be okay and explain the procedure. I'm going to apply a cervical collar. After doing so, you will get your measurements. You will extend and join your 4 fingers. You will place your thumb at a 90-degree angle. You will insert it on the side of the Casualty's neck. I will use my right hand just so everybody can see. What you're going to do is ensure that the chin is resting on the top portion of your thumb. And what you're reaching for with your fingers is the back portion of the trap and where your fingers lie. Right now, the back portion of the trap is lying underneath my ring finger. So this will be my measurement. Okay? I would take this measurement and take it to my cervical collar, which is adjusting it to the manufacturer's instructions. Now, the way to operate this cervical collar, you're going to lift up on these 2 buttons, pull out these 2 slides, and you'll be able to manipulate your cervical collar. All right. So the way to apply your measurement to your cervical collar, what you're going to do, you're going to take that measurement that you received, you're going to place your index finger underneath this black line here. There'll be a sticker off to the left of your cervical collar. All right. Index finger is going to go underneath it. And what you're going to do is you're going to adjust this bottom portion of the cervical collar to where it is parallel to that bottom finger where you got your measurement, okay? Easiest way to do so is to use your non-dominant hand. So whenever you are manipulating the cervical collar, whenever you are taking your knee, you can place your non-dominant hand underneath that black line and then manipulate your cervical collar with your dominant, all right? And what you're gonna look for is ensuring that that index finger is over top of that black line and that that bottom finger is parallel with the plastic portion of the cervical collar. You are then going to lock those adjustments into place by pressing on those two buttons, sliding in the two slides. Just locked in place. Now you will apply your cervical collar. Easiest way to do so: place this Velcro strap through the back side, find it on the other side, pull it through, pull the cervical collar over, and then place that Velcro strap. At this time, you will direct your assistant to maintain head and neck inline stabilization of the casualty. The same thing that you stated in the first step. And then you will continue to immobilize your casualty. First, you will start with the straps. The way you manipulate these straps, it'll automatically go to the locking position when you lift it up. All right. You can either press on this nut here to release it and lock it down, or what you can do is just move this off to the left, cinch it down. All right. All right, after you fully immobilize your casualty to the litter, you are going to move up to the immobilization block located at the casualty's head. Now, Sergeant First Class Ringer is going to demonstrate how to do so.
Hey, check it out. It's super easy, guys. It's super easy. Obviously, the patient's head's going to be on the foam part, right? So what you're going to do is you're going to flip this up so you can move this part here, all right? So you can flip that up. It doesn't take much force, all right? So you just barely flip it up. I've seen guys rip this off, break it, whatever. So we're trying to keep the equipment working for test day 2. So just be aware of that. So it just flips up nice and easy. It doesn't take a lot of pressure. So once you flip that up, this lever here, once you pull up on it, it's actually going to move the sides to stabilize the head. But if you yank on it and pull on it so hard and your patient's head explodes, you'll be a no-go. I'm just kidding. But if you pull it to where it's snug, it's fit on the side of the head to make it stabilize, and then you lock it back in place, and that's it. All right? Any questions? Pretty simple, right?
All right. Like Sergeant First Class Ringer stated, I'm going to lift up on this latch, pull back on the lever, stabilizing the casualty's head onto the immobilization block, lock that in place, and then I'll place the Velcro strap over top of the casualty's head, securing it to the spine board and litter, and now your casualty is fully immobilized. After immobilizing your casualty, you're going to assess for shock. The first step is to assess the level of consciousness. You will do so by waving your hand and saying hello, where your grader will state,
Casualty does not answer, but reacts to pain.
all right, at this time, you will write your assessment of the casualty's consciousness level on your note card. You'll write down pain. Reason being is because you're going to translate this information onto your TC3 card, which is within that final performance measure step, okay? Now that you have assessed the consciousness level, you are going to evaluate the skin. You are going to do so by removing one of the gloves and evaluating like so.
Skin is pale and moist. Abdomen is distended.
All right, after you have evaluated the skin, you will test for the capillary refill. You will take that index finger of the casualty, place your index finger underneath, take your thumb, press on top of the fingernail, and then release.
Capillary refill takes 4 seconds.
After you've done so, you're going to move down to the pedal pulse, where you will notionally remove the boot and the sock and get skin-to-skin contact with the top portion of the foot. So feel for a pulse. Skin to skin contact, no thumb.
Do not feel a pulse.
Then you'll move to the femoral artery. You will not actually get skin to skin contact, but you will note that you are getting skin to skin contact, no thumb.
Do not feel a pulse.
You move up to the wrist where you will check for the radial pulse. You will get skin to skin contact, no thumb.
Do not feel a measurable pulse.
All right, after you've done so, you'll move up to the carotid where you will insert your 2 fingers into the cervical collar on the side of the casualty's neck and feel for a pulse.
Do not feel, oh wait. You feel a weak but rapid pulse.
All right, after you've gotten that description from the grader, what you're gonna do is you're gonna measure the pulse for 30 seconds while looking at your watch.
30 seconds as elapsed, 150 beats per minute.
All right, at this time, you're gonna go back to your note card. We're gonna place down, you got 150 for the pulse rate. You're gonna place the location as well, which is the carotid. And you write down the time at which you got it, which would be 11:36. All right, at this time, you move on to assessing for respirations by watching the rise and fall of the chest.
Respirations are rapid but shallow.
All right, after receiving that from the grader, what you will do is assess the respirations, measure the respirations for 30 seconds while looking at your watch.
30 seconds as elapsed, 60 over P.
All right, what you're gonna do is you're gonna take that information, write that on your note card as well, 60 over P. After you're done doing so, you are done assessing for shock. Now you're moving into treat for hemorrhagic shock. What you are going to do is ensure that your straps or that your casualty is strapped to the litter. And you're going to move your casualty into shade and or shelter out of direct sunlight. So what you will state is, I am moving my casualty into shade and or shelter while maintaining spinal immobilization and in a supine position. Now, with that verbiage, it can be something along the lines of, I am moving my casualty into shade while maintaining stabilization of the casualty, or while maintaining the immobilization of the casualty. Everybody tracking? All right. So, after you have said that, notionally done that, your grader will state that your casualty has been moved into shade and or shelter. Now you'll move into loosening any restrictive clothing. You will start with the straps. After you've removed the straps, you will start loosening all the restrictive clothing from the top all the way to the bottom. You will first start with the flick, and you will go to the top. You'll go down to their belt, loosening their belt. You will get the cuffs, loosen them. After you've loosened the cuffs, you'll remove the glove. You'll go down to the bottom portion of their pants where they are bloused. You'll loosen the blouse, you'll loosen the boots. After you have done so, you are done loosening all your restrictive clothing. Now you will move into preventing from chilling and or overheating by utilizing your space blanket. Now with your space blanket, you will ensure that it is tucked underneath the cavity and underneath the strap. But seeing as though this is already elevated, I obviously can't tuck this underneath this litter. But note that whenever it is over there, set up like that, over there, you will ensure that this is tucked underneath the litter and underneath the straps. So, once you have done so, you will re-secure the casualty to the litter. Alright, after you have re-secured your casualty to the litter, what you're going to do is calm and reassure your casualty. It is going to be okay. After you have calmed and reassured your casualty, you will watch for any further life-threatening conditions. After doing so, you will take the notes that you took earlier for the respiratory rate and the pulse rate, You will place it onto your TC3 card and continue filling that out, which Sergeant First Class Stanley will demonstrate.
All right, guys, so this is the card. This is the actual card you guys are going to use, okay? It's just a blown-up version of the real one. So we blew it up to make it easier for you guys. You guys take a look there, pass it on. So with this card, all right, guys, so we already filled out the stuff that only applies to you, all right? So if it's blank, don't worry about it. Don't worry about it. So you got the first page of the card, second. So first page, starting at the top, says evac. Go ahead and check urgent, okay? Underneath that, it says date. With that, there's a format on here, okay? And it's on the card too. So look at that format. It's gonna be day, month, year. Like today's date is the 11th. So the way you're gonna do it is 11, March, MAR, and then the year, 20. Okay? That's the format that we want. Any other format would be a no-go. Right next to that, it's gonna be the time, all right? So if you're taking the test right now and you get to this part, you look at your watch, 11:43 with the little L on the end for local, okay? So 11:43 local. It can either be local or it can be Zulu, okay? Just go ahead and just do local. It's easy. Underneath that, it's gonna say mechanism of injury. So what happened to this guy?
Fell.
Fell out of a guard tower. He fell, right? So go ahead and put a check in the fall block. Underneath that, for injury, you got the little picture of the guy, right? So this is the back side. Go ahead and put an X on the back, and that's to signify where the injury is. Draw a line from the X out to the middle, and write spinal injury and internal bleeding, okay? Those two things, those two injuries, where did we get those from?
The distended bleeding and the distended abdomen.
The conditions, okay? It states it in there, all right? Under that, signs and symptoms. So, like Sergeant Bryce was talking about, go ahead and pull your card out, all right? This is where all this information right here, it's all right here. So, you're gonna look at your card, get the time that you took the vitals, okay? Go ahead and put that time in there. Underneath that, it says pulse, rate, and location. What was the pulse rate we got?
150.
150? And where was the location we got it?
Carotid.
At the carotid, okay? So, it's gonna say 150 carotid, right there in that block. Underneath that, it says respiratory rate for his breathing. What do we get for that? 60 over P, okay? So right in there, 60 over P. And then the AVPU is response.
Okay.
He only responds to pain, right? So go ahead and just write pain in that block. It's too easy. Now for that section, that completes that section right there. I don't want you guys to get too wrapped around the 150 and the 60, okay? For test day, those two numbers are gonna change. So when you come up and you get that pulse rate and you get that respiratory rate, the numbers we give you will be different than it is right now, okay? We'll give those numbers to you, all right? So don't get too wrapped around the 150 and the 60. Those will change. At that time, go ahead and flip your card over. Again, it's gonna say evac at the top. Go ahead and put a check in the urgent block. Underneath that, it says treatments. You're gonna go ahead and check the other block. And on the type, on the blank line under that, cervical collar. Because that's one of the treatments, right? Gave him a cervical collar. Skip the middle portion, working your way down, go to the next other section. It says hypothermia prevention. What did we do for that? Yep. So again, there's a line that says type. Just write space blanket right there on the blank line. Underneath that, it's gonna say notes. You write in SM for service member. SM, complaining of nausea, difficulty breathing, and abdominal pain. And those three things, where do we get that? It's all in the conditions, okay? Underneath that, it says first responder. Who's that?
Us.
That's you guys.
Yep.
That's you guys. Last name, last four, or sorry, last name, first name, last four. Now when it comes to last four, it can be your last four, we don't care. It could be 0000, 1, 2, 3, 4. Last 4 digits of your debit card. Your dog's birthday. Or if you got a hamster, its birthday. Whatever. It doesn't matter. As long as there's 4 digits there, okay? Any questions about filling this out right here? Nothing? Okay, so after you guys are done filling out the card, so if this is the card here, just take it, fold it in half, roll it up. You're gonna take it underneath the space blanket, underneath his kit or his top. You're gonna take that and just shove it in there. Tuck it in there, okay? So, just right in there, done. After that, you were complete, you're done. So if you think you were complete and done, let us know that you were done. Because you're just gonna stare at us, we'll stare back at you, it's gonna be weird. So, let us know that you were done, and we will act accordingly. So, with that being said, when you guys are doing these tasks, let us know what you guys are doing. So, like as you're doing it, like you're checking his pulses, right? So, hey, can you hear me? Can you hear me? I'm checking his response. He responds to pain. You're gonna move down, check his feet, check his pedal pulse. I'm checking his femoral. I'm checking his radial. I'm checking his carotid. I'm timing it for 30 seconds. Let us know what you guys are doing, especially when it comes to the card. I'm filling out the date with the day, month, year format. I'm filling out the time, which is the local time. I'm doing the injuries, spinal injury and internal bleeding. I'm writing down the notes, service members complaining of nausea, difficulty breathing, and abdominal pain. If you say it as you do it, it'll help us grade you a whole lot faster, okay? So we don't have to sit there when it comes to the card, especially. When it comes to the card, now I gotta pull it out. If you don't say anything, I gotta pull that card out, I gotta look at it. So if you got done at, say, 6 minutes and 30 seconds, right? And you only have 7 minutes, so it leaves 30 seconds left. It takes me 20 seconds to grade that thing. Now I gotta put it back on the guy's chest and say you have time remaining. There goes 3 seconds. See what I'm saying? So now you got 8 seconds to find out what's wrong. Does that make sense to everybody? So let us know what you guys are doing. Any questions about anything? What's up, man?
You have 7 minutes for all of this together, correct?
No. So you have 1 minute for this, and then 7 minutes for everything else. And it says it right here. Then 1 minute, and then apply the circuit collar, and 7. Any other questions?
You have to use like a note card. You can't just fill that out as you go.
It doesn't state it in the directions, so you can write it straight on here if you want.
Wouldn't you still have to shove the note card in there, though? Sorry.
You're shoving this in there.
Oh, okay. So is that the note card, or
it's just a note card because
oh, okay, because you're passing
I'm
around.
getting all this stuff.
Okay.
You guys, this is your TCC card. Okay.
Okay.
You can roll it up and shove it in the top.
Okay.
Yeah, not the little note piece of paper. Any questions about anything? So the only thing that's going to change on this for test day, what's going to change?
Numbers.
The blood, the pulse,
Time,
and the
date.
respiratory, right?
Time and date,
But what's the date going to be?
the day you're testing,
Okay, what's the time going to be?
the time you're actually doing your testing.
Okay.
Everything else, like the 150 carotid, the 60 over P, the pain at everything else, the hypothermia prevention, everything else should be the same.
Correct. These two numbers will change.
Okay.
These will go to the day that you test, and this will go to the day and the time you test. All right. So the time that you test. Got it? That is it. I just want to make sure we're clear on that. That makes sense?
So you have 2 times on the actual card.
Yeah.
Those
so
are differing
this is the time
because-
that you're as you're reading this, it's going to say what's the time.
Okay.
So you're gonna look at your watch probably, because when we see something that says time, you're just gonna write the time down. I know that these two will probably be different. whatever. So you're gonna get this one first, obviously, because you're doing the vitals.
Mhm.
This one will get last.
Okay.
It's just 2 different times. I understand this is 10 o'clock, this is 10:05. It's an
Okay.
opposite order. I got it. So, any questions? What's up, man?
Sergeant, on the applying cervical collar,
Yeah.
it was number 4. Do we have to state to tell the other soldier that we're maintain manual stabilization of the head and neck?
What does it say in the book?
It just says that I have to do it, or the candidate does. It says maintain manual stabilization of the head and neck until the casualty is immobilized along spine cord.
Is that the? Let me see. Where's it at up here? So we can all see. it.
Number 4, right there, Sergeant.
Down here.
Not the one
Under
right behind
E.
your head, Sergeant.
Under E.
4 right here. Secure the. Okay, yeah. So you're gonna be telling your assistant. Yeah. So secure Velcro strap.
So the person is going to be maintaining the stabilization of the head, your assistant. But if you state it, like our first class Stan was saying earlier, it's easier for us to grade. So that we know that you know that you're not missing that stuff. Alright? It's easier that way. So, is there any other questions? Everybody understands why to state that?
So you're gonna put the collar on there, put the strap, maintain stabilization, go into everything else.
Can we like opt to have someone actually stand there? So like,
Yeah, we got an assistant. We'll have an assistant there for you.
okay. That way,
Yeah. So when you guys come up to it,
you don't have to remember the notes.
it's gonna look just like that right there, guys. You're gonna have a guy laying on the backboard and a guy standing on his head. That's it. So your assistant's just gonna be standing right here like this, and then you just tell him to maintain, and he will hold that dude's head. You guys got any questions? Anything else? All right, you guys are more than welcome to come